We often rely on doctors to heal us, but in a crisis, the person who starts the life-saving process is often yourself or a loved one. Today, we're diving into a topic that touches us all: heart attacks. We'll explore the subtle warning signs your body might be giving you, and just as importantly, what crucial steps you can take if you suspect a heart attack. Let me share a real-life example. It all started with an unusual fatigue. It wasn't the kind of tired you get after a long day at work. It was a deeper, more insistent exhaustion that settled over Robert like a thick blanket. It began about 2 weeks ago. He'd be doing something simple, like carrying a basket of laundry up the stairs or raking a small section of the yard, and he would have to stop and catch his breath. His wife, Maria, noticed it right away. At first, she admitted, she thought he was just being lazy. "I thought he was trying to get out of doing chores," she'd tell me later, shaking her head at her own cynicism. But it got worse. The fatigue was accompanied by a strange pressure in his chest, a feeling he described as something heavy sitting on me. He'd sit down on the edge of the sofa, a clammy sweat breaking out on his forehead, his face pale and almost gray. It was in those moments that Maria's concern shifted from annoyance to alarm. "We need to get you to a doctor, Robert," she insisted one afternoon, her voice tight with worry. "I'll make an appointment," he promised, but they never got the chance. Later that week, as they were sitting down to dinner, Robert suddenly gasped. He clutched his chest, his face contorted in a grimace of sharp, blinding pain. It was a crushing, unbearable ache that took his breath away. Maria flew from her chair. "Robert, what is it?" she cried. "Call 911, he choked out, his voice a strained whisper. No, don't drive me. They'll get here faster. Just call 911 and unlock the front door." Then, his voice gaining a surprising clarity and strength despite the pain, he said, "And help me relax on the sofa. Just let me sit here and wait." While she was on the phone with the emergency dispatcher, Maria followed his instructions precisely. She helped him to the sofa and propped a pillow behind his back. She didn't panic. She didn't try to lift him or drive him to the hospital herself. She simply stayed with him, holding his hand, her own breathing a steady counterpoint to his labored gasps. The paramedics arrived in minutes. At the hospital, the doctors confirmed that Robert had suffered a major heart attack. The cardiologist later told Maria that Robert's quick thinking and his calm, specific instructions had likely saved his life. Instead of being jostled in a car, he was able to stay still and conserve energy. Instead of waiting for Maria to drive him through traffic, he put his faith in a system designed for this very emergency. This real-life example shows that the most important care can indeed come from yourself or a loved one. Now, let's get into the essential knowledge that allowed Robert and Maria to act so effectively. Robert's story happens every day. Millions of people experience heart attacks annually, and while not everyone has identical symptoms, there are dangerous patterns we need to recognize immediately. The classic chest pain isn't always like the movies. Instead of clutching your chest dramatically, you might feel like there's a heavy weight sitting on your chest or a tight band squeezing around your torso. Some describe it as severe heartburn or a stabbing sensation. Here's the key difference. This pain lasts more than 30 minutes and doesn't improve with rest or heart medications. Why does this happen? When a blocked artery cuts off blood to your heart muscle, that muscle begins to die. Your heart is packed with nerve endings that scream pain signals to your brain. It's your body's emergency alarm system. But here's what surprises most people. Heart attack pain travels. It can shoot to your left shoulder, arm, jaw, neck, or back. This happens because your heart shares nerve pathways with these areas. Your brain gets confused about where the pain is actually coming from. Many women experience jaw pain that feels like a severe toothache, while others feel a deep ache traveling down their left arm. Your body sends other distress signals too. You'll break out in cold, clammy sweats as your body goes into shock. You might feel like you can't catch your breath because your struggling heart isn't pumping enough oxygen. Nausea, vomiting, and dizziness are common as your body's stress response kicks in. Here's a dangerous trap. Sometimes heart attacks feel exactly like stomach problems. You might experience upper belly pain that seems like food poisoning or severe indigestion. This happens because the bottom of your heart sits close to your stomach. People dismiss this as a stomach bug and delay treatment, which can be fatal. The most dangerous type is the silent heart attack, especially common in diabetics and older adults. Instead of crushing chest pain, you might only feel unusual fatigue, chest tightness, or shortness of breath during normal activities. Diabetes can damage the nerves that carry pain signals, and our nervous system becomes less sensitive with age. Don't ignore these subtle warnings. Now, for the life-saving actions. Remember, time is muscle. Every minute counts, and the faster you act, the more heart muscle you save. First, call 911 immediately. Not your doctor, not a family member for a ride. Paramedics can start saving your life the moment they arrive. They carry medications and equipment that hospitals have, plus they know the fastest routes. Most crucially, if your heart stops during transport, they can perform CPR and use defibrillators. Your family member driving cannot do this. Stay completely still. Find a comfortable position, lying flat with legs elevated, sitting with back support, or semi-sitting with pillows. Moving forces your already struggling heart to work harder. Treat it like any injured body part and let it rest. If you have aspirin and no allergies or stomach bleeding history, chew 2 to 4 regular tablets immediately. Chewing, not swallowing, gets it into your bloodstream faster. Most heart attacks are caused by blood clots, and aspirin helps prevent them from growing larger. Loosen all tight clothing around your neck, chest, and waist. Open windows for fresh air. If possible, unlock your front door so paramedics can reach you instantly. Be prepared for CPR. If someone becomes unconscious and stops breathing normally, start chest compressions immediately. Place the heel of your hand on the center of the chest, between the nipples, put your other hand on top, and push hard and fast at least 2 inches deep. Pump 100 to 120 times per minute. Don't worry about breaking ribs. Brain damage from lack of oxygen is permanent, but broken ribs heal. Now, the deadly mistakes that kill people. Don't wait to see if it gets better. Heart attacks don't improve on their own, and every minute means more heart muscle dies. Don't drive yourself. You could lose consciousness or have heart rhythm problems that cause accidents. Don't take pain medications like ibuprofen or Tylenol. They mask symptoms doctors need to see. And never let embarrassment delay treatment. Emergency rooms see chest pain every day, and medical professionals would rather treat a false alarm than lose someone who stayed home. Here's what you need to remember. Chest pain lasting over 30 minutes that feels like pressure or burning. Pain spreading to your arm, jaw, or back. Cold sweats with shortness of breath, or just unusual fatigue in older adults and diabetics. When this happens, call 911 immediately. Stay still, chew aspirin if safe, and be ready for CPR. Robert and Maria's quick thinking saved his life. This knowledge could save yours. Your heart needs your help in a crisis, and taking the right action in those first minutes makes you the most important person in the chain of survival. Share this with people you care about. You never know whose life you might save. When it comes to heart attacks, it's always better to be safe than sorry.